Hello, my name is Alice, and I will be discussing a medication error case scenario and the steps to avoid a future recurrence. Case scenario: a 53-year-old male patient, WK, was admitted to the ward following a new onset of a seizure. He had come to the healthcare facility because he worried over the meaning of the seizure. Although he had previously been on medication, he was started on Klonopin 1 milligram. The new drug was not up from the pharmacy yet. Nonetheless, the nurse stayed with the patient and educated him about the new medication he would start taking. A little while later, the nurse took a telephone order by the doctor for a different patient who had similar sounding names to the first patient, WK. The order placed for the second patient was clonidine 0.1 milligram, and the medication was ordered by the nurse, who returned to the medication room to set up medications for yet another patient. Slide number 3, that's continued. When the nurse got to the medication room, another nurse looked through the medication trays and stated that she could not find her patient's medication, which the pharmacy had said was already dispensed. The first nurse realized her error when the second nurse said that the missing drug was clonidine 0.1 milligram. At this point, the first nurse checked the medication label that she had in her hand and realized that the names on the label were not that of her patient, but rather the name of the second nurse's patient. The birth date of the second patient was indicated on the label. The first patient's doctor was informed of the medication error, and he ordered that the patient's vitals be monitored for 2 hours and consequently for 4 hours, but with 2-hour intervals. Although the patient had a lower blood pressure, she did not experience any adverse effects and recovered well. Slide number 4, Safety Improvement Plan. What went wrong? In this case scenario, the patient's names were similar. However, the nurse failed to check the names on the wristband of the first patient as the policy required. The nurse had spent some time with the patient and felt that she knew him well and she did not bother checking the names on the wristband against that on the medication label. It was also indicated that other nurses did the same thing. They never followed the name and birth date policy in confirming a patient. Also, the patient's band information was illegible and made it hard to read. Although the two patients were in different rooms, the medication trays were placed on top of each other with nothing separating the two or warning the similarity in names. PowerPoint slide number 5. What should have been done? The staff must replace the patient's label once it becomes illegible in the hospital's patient identification policy. Still, the nurse failed to do so in this case, which contributed to the medication error. The medication trays were placed one on top of the other, yet the patient's names were similar, hence there was no way of easily differentiating the trays. The nurse should have asked the patient to verbally state his name, and date of birth, and countercheck this information against the information on the wristband and the medication label. Slide number 6, Proposed Plan and its objective. According to the Joint Commission, it states that at least 2 patient identifiers are used when providing patient care. treatment, and any services. The Joint Commission's goals was to have a reliable way for a healthcare practitioner to identify the patient, the intended service, or treatment that is targeted. The acceptable identifiers that the Joint Commission proposed are the patient's name, phone number, identification number, or other specific identifiers such as the date of birth. Wristband scanning can reduce additional costs and length of stay in the hospitals. Further, the technology is effective in ordering medications made by the physician, dispensing the drug by the pharmacy, and medication administration by the nurse. This technology aids in the patient's safety by assisting the nurses incorrectly identifying the patient. McBee et al. 2019. PowerPoint slide number 7. Why it is important to have the wrist barcode system. Patient identification using a wrist barcode system upon admission is necessary for accurate patient processing. Barcode wristbands can optimize staff time, improve patient safety, and increase staff satisfaction. The barcode system will ensure that upon admitting the patient, it can accurately track patients. The barcode system can positively improve quality care, impact operations, asset tracking, and operating room safety. Lewing et al. 2017. When patients have wristbands, the nurses can automatically call up their EMR records and update their charts. With wristband barcodes, the patient always has critical information as they move through the hospital. Nurses and healthcare staff in the patient's care team can access medications, specimens, records, and equipment location in real time. This easy access ensures patient safety. Shah et al. 2017. Slide number 8. The role of the nurse in medication safety. Nurses play a critical role in patient safety because they are often the first line of contact with the patient. When patients first come to the healthcare facility, their information will be recorded and stored in the EMR barcode system, and the patient will receive a wristband with a unique barcode. The barcode will be unique to the patient and will be used to assess all the information regarding the patient. Nurses will be responsible for recording this information. Throughout the patient's stay at the hospital, the nurse will scan the barcode to update the medications administered to the patient, the treatment process, and progress. The nurses will scan the wristbands and the medication package label as well. Slide number 9. The medication barcode system will benefit nurses because the system will reduce the information recording error rate. The system will also record patient information faster than entering the information manually in the EMR system, thus saving the nurse's time. This will potentially increase the nurse's job satisfaction and the patient's outcome. Hask et al. 2017. Nurses will need to follow the patient identification process as per the healthcare policy to avoid any medication errors. When all the nurses are careful to observe the medication administration policies, it will cost the facility less because of minimizing the possibility of increased length of stay and potential lawsuits from sentinel events. Ching and Koo 2017. Slide number 10. New process and skill practice. The nurses will attend a 1-week training on using the newly integrated barcode system in the current EMR system. The nurse leader will demonstrate the process of medication administration using the new system. The first step will require the patient to identify themselves and their date of birth verbally. The nurse will then confirm the information on the medication package label. The next step will require the nurse to scan the wristband code with the scanner, which will display the patient's information on the handheld EMR device. Once the nurse confirms the right patient, medication, and dosage, the medication administration will be initiated. The nurse will then update the dosage administration into the patient's EMR. The nurse leader will use a dummy when demonstrating the new medication administration process. Slide number 11, questions and answer session. To gauge our understanding of the new process, I would like you to cluster into groups of 3 and answer the following questions. These are questions that I kind of created for the purpose of this PowerPoint. So question number 1, when should a patient get a wristband code? Question number 2, what are 2 patient identifiers stated in the hospital policy as necessary before a nurse administrator administers any medication? Number 3, what are the 4 steps of medication administration using the new barcode system? What should you do after administering medication to a patient? State 2 ways that the hospital will save in costs from the new system. And lastly, state 2 ways that the new system will benefit you as a nurse. I've also provided the answers in the PowerPoint slide. PowerPoint slide number 12 is the feedback session. The hospital administration would like to know about your experience with the new system. The 1-week training session will start a week from today. Each one of you will be allowed to test the new system before the IT team activates it for live use. After the training, each of you will be administered a questionnaire that will collect information on your individual experiences and suggestions on improving the system's efficiency, and effectiveness. Your suggestions will be considered when making changes to the system. Once the system goes live, you will use it for a 2-week period, after which another meeting will be convened. The nurse informaticists will record your feedback on using the system during the meeting. Please note that your feedback is valuable as it will help the IT team to help you improve your workflow. It takes a team effort to reduce medication errors and improve workflow. Again, my name is Alice. I hope you have enjoyed my presentation, and I've also included the references at the end of this presentation. Thank you.